Hello and welcome to episode 4 of the Harmonious Psychology Solutions Menopause series. This episode is all about the various ways that menopause can cause pain and reduce mobility. As always, we will suggest some ways to improve these symptoms. Let's get started. So there are several things that can happen in menopause that cause pain. One of these things is intense cramps. During your period, when you're going through perimenopause, the cramps may intensify and become more painful. This is because cramps are caused by estrogen dominance. So the cramps experienced will be a similar level to when you were going through puberty and you were having your first periods, and the cramps were much stronger then. Another source of pain during menopause can be breast tenderness and pain, and this is caused by irregular hormone spikes, such as the fluctuations in progesterone. And again, it's similar to the kind of breast pain that is experienced during a menstrual period when the hormones are also fluctuating. But these periods of breast pain can be much more random and last for longer periods of time. Headaches and migraines are also more common during menopause, and these are caused by reductions in estrogen. If you are someone who has experienced hormonal migraines anyway before menopause, they can also become more frequent because the hormone cycle occurs more often during menopause. Another type of pain experienced during menopause is joint pain, and this is because estrogen is an anti-inflammatory hormone, so it can protect joints from swelling. But its reduced levels during menopause means the joints are no longer protected and joint pain can occur. Menopause can also cause fibromyalgia, which is a long-term condition that causes pain all over the body. And the majority of women who have fibromyalgia are diagnosed between 40 and 55 years of age, which coincides with the average onset of menopause. Studies have shown that the relationship between fibromyalgia and menopause may be due to the decreased levels of estrogen that occur during menopause and the decreased levels of cortisol, which happen during menopause, may also be a contributing factor. A lot of women also experience pain during intercourse throughout menopause. This is likely to be caused by the decrease in estrogen as well, which can lead to vaginal dryness and thinning of the vaginal tissues, which leads to pain during sex and can also cause tearing or bleeding. The reductions in estrogen could also weaken the pelvic floor muscle and the lining of the urethra, which can lead to painful urinary tract infections, which make it painful to urinate and have sex. So we have quite a few suggestions on how to help manage pain. For reducing cramps, we recommend eating a healthy, balanced diet full of foods such as fruit, veg, and whole grains, which can really help to reduce stomach cramping. We also recommend the use of heat pads to gently heat the area or even a warm bath, as this can relax the muscles that are cramping. Another option is to avoid caffeine and alcohol, as they can irritate the stomach, and we don't want to irritate the stomach as this can cause pain in the muscles around it. Another option is to try and do some light exercise when the cramps are happening, as this increases blood flow to the muscles, which can help to relax them. So I recommend exercises such as walking or a very light ab workout. But if cramps continue after menopause, it's important to see a doctor because they may be being caused by something else. To cope with breast soreness, the NHS recommends numbing gels, mild painkillers such as ibuprofen or paracetamol, and wearing a properly fitted bra. However, if the pain continues past menopause or you experience changes in the ways that your breasts look, such as a lump or dimpling, you must see a doctor immediately. Eating small, frequent snacks to stabilize your blood pressure can help reduce migraines, as unstable blood sugar levels are non-hormonal causes of migraines. Both natural and medicinal anti-migraine medicines are available, both via prescription and over the counter, and can be quite effective in reducing or treating migraines. Hormone replacement therapy or estrogen patches can also be prescribed to really get to the root of the cause of hormonal migraines. We can also manage joint pain by consuming larger amounts of protein to support the muscles and tendons around the joints. And this helps to strengthen the joints. We can also strengthen the joints through exercise, through light weight-bearing exercises such as walking, gardening, dancing, or light weightlifting. Another factor that can really help with joint pain is to stay hydrated, because we have fluid around our joints, and when we get dehydrated, this fluid gets depleted. So helping to maintain the fluid around the joints can also help to sort of ease the friction in the joints. Unfortunately, there is currently no cure for fibromyalgia, but doctors can help to ease the symptoms of pain through medicinal treatments such as painkillers, muscle relaxants, and therapy. If you have a urinary tract infection, you should go to the doctor as you may need antibiotics. But cranberry juice is also recommended for its antioxidant properties to help clear up a urinary tract infection. To prevent further urinary tract infections, you should drink plenty of water and urinate regularly. Wipe front to back and urinate immediately after intercourse, avoiding the use of scented feminine cleansing products. Taking probiotics can also really help to get the good bacteria into your system, which can fight off the bad bacteria which give you infections. And to make intercourse less painful, try to relax, as being tense will cause your muscles to tense and make it hurt more. You should also use plenty of lubrication to counteract dryness. Now let's move on to your mobility during menopause. Estrogen helps us to maintain muscle mass, so when our estrogen decreases during menopause, we end up with lower muscle mass than before, and this can really decrease our mobility. To manage these problems with mobility, we should strengthen the muscles again by doing weight-bearing exercises. So this is anything that uses the weight of your body or something extra to exercise and strengthen the muscles. It's really important you stay active when you have mobility problems. So even if you don't enjoy exercise, just a 10-minute walk can really improve your mobility and decrease the pain associated with it. It's also recommended that you eat plenty of protein. At least 1 gram of protein should be consumed per kilogram of your body weight every day. This will help you to maintain the muscle mass that you are gaining through strengthening the muscles more, and will help to stop the decrease in muscle mass from further continuing. Practicing yoga and stretching can increase our mobility by increasing our flexibility. This is a really gentle way to increase your range of motion and improve mobility. Maintaining strong and healthy bones is also a really important factor in mobility, so eating foods that are rich in vitamin D or taking vitamin D supplements can be really helpful. Foods that are high in vitamin D include oily fish such as salmon or mackerel, red meat, eggs, and some fortified foods such as breakfast cereals. In some countries, milk is also fortified with vitamin D, but in the UK, this is not the case. Thank you for listening to this episode about pain and mobility in menopause. We really hope you enjoyed it, and we really hope that you learned something about how to protect yourself from these problems. As always, here's a list of references for you to check out if you'd like to know more. We would also like to remind you that this series is for educational purposes only and is not medical advice. You should always check with your doctor if needed. I hope you'll join me next time when I'm going to talk about cognition changes during menopause. See you next time.